Assalamu alaikum. Today's topic is pancreatitis and modified CD severity index. The CTSI scoring is based upon three criteria: pancreatic inflammation, pancreatic necrosis, and extrapancreatic complications. And each of these features has been assigned an even number from 0 to 4, as you can see. A score 0 has been assigned to the abnormal pancreas. If there are mild pancreatic parenchymal changes in the form of enlargement, edema, with or without streaking of the peripancreatic fat, a score 2 has been given. If there are collections in the peripancreatic region or even in the pancreas itself, those can be fluid or necrotic, a score of 4 has been assigned. Next comes pancreatic necrosis, which means necrosis of the pancreatic body, tail or head itself. If there is no necrosis, then a score of 0 is given. If necrosis involves less than 30% of the body of pancreas, then a score 2 is assigned. And if the necrosis involves more than 30% of the pancreatic parenchyma, then a score of 4 is assigned. And the third criteria is extrapancreatic complications, which may be in the form of pleural effusions, ascites, or vascular complications. Vascular complications can be of two types, as you may know: venous thrombosis, which may involve tympanic vein, pancreatic vein, or portal vein, or arterial complications, which may be in the form of aneurysm formation. GIT involvement is most commonly at the colon, especially at the splenic flexure. Gut involvement may be in the form of ischemia, wall thickening, or obstruction. Ischemia may be due to the mesenteric vascular involvement. As you know that splenic flexure is in the watershed area, so it is most prone for ischemic changes. So these are the bases of modified CT severity index. And now moving on to today's case, on which we can apply the CT severity index and see where we can go. As the assigned number in this scoring system are all even number, so the final score will always be an even number and not an odd one. So this is a small test on which you can judge your score. So this was the case of a 35 years old female patient who presented to us with acute complicated pancreatitis. In this image, as you can see, there is extensive peripancreatic necrotic collections. Now the way to tell whether a collection is a fluid collection or a necrotic collection is of course by the density. CT density of more than 20 indicates a necrotic collection. So the density here was between 30 to 40. So this was a necrotic collection. And pancreatic tissue itself was edematous, swollen, but there was no portal vein thrombosis, no pleural effusion. Rest of organs were all normal except a little ascites in the pelvis. So basing upon these findings, one more thing, there was no pleural effusion in this patient. So what can be your modified CTSI in this patient? I will of course tell you the answer at the end, but I want you to assess yourself first. So total CT score of this patient was 6, and she had moderate acute pancreatitis with a complication of ascites. I hope you enjoyed today's presentation. Thank you for your patience. See you next time, inshallah.